generation matrix for tissue repair. So what I really want to focus on is the broken biology of tissue repair, specifically chronic non-healing wounds like diabetic foot ulcers. The chronic wound care market is estimated to be $25 billion by 2032. There's 37 million diabetics in the US, 1.6 million of them get a diabetic foot ulcer every year. 300,000 of those never heal. And we as a US healthcare system spend about $2 billion treating these, and they ultimately many of them end in failure. This problem is only accelerating as the population gets older, as well as comorbidities increase, such as diabetes and obesity. It's estimated that 2% of the global population will experience a chronic wound. And current regenerative therapies fail. Over 50% of patients do not respond to regenerative products. And why is that? There's a broken matrix or a broken scaffold. It's filled with inhibitory signals saying, do not heal. So we ask the question, what if we fix the matrix itself? For those of you not familiar, your tissue is made up of cells plus matrix or extracellular matrix. It's the protein scaffold around it, providing mechanical strength as well as biochemical cues. So healthy tissue is made up of good cells plus good matrix. So we've developed a next generation matrix engineered to promote regeneration, not just repair. And so we knock out a gene called thrombospondin 2 or TSP2. It's a natural inhibitor to angiogenesis and remodeling. So if you knock out an inhibitor, you end up promoting those pathways. You end up getting, what makes it next generation is it's the only gene-engineered ECM product on the market. It would promote active remodeling by your cells, angiogenesis and cell infiltration, pro-healing regeneration for true functional tissue restoration. And it would be, in this form factor, as a hydrogel that you would apply to a chronic wound. So what does that look like in practice, actually as a product? Well, you start with genetically modified skin. Just like you wash dirt out of your clothes, you can wash the cells out of these tissues to leave behind that protein scaffold, the extracellular matrix, here indicated in white. You can then actually process that into a liquid form and then dispense that liquid onto a wound, which then heats it up and cross-links it to form a semi-stable hydrogel. This is amenable to large batch manufacturing, but this manufacturing process isn't new. It's acellular, which simplifies the manufacturing process, and the biology is built in. Many other products focus on adding in drugs or cells. Ours, the biology is baked into the matrix itself, enabling us to be regulated as a Class 2 medical device. It's designed to hit wound care cost targets, and we have a manufacturing partner identified and engaged. Here's just a snapshot of some of the data. This is taking our engineered matrix and implanting it into diabetic wound models. This is a diabetic mice. So we crossed a species barrier representing what you would see in the clinic going into patients, as well as there's that comorbidity of diabetes. In the leftmost, you see what happens on a wound normally, where you get really thin skin. Wild type is representative of all the products on the market. And then lastly, you see our TSP2 knockout ECM, where you see robust epithelium and mature collagen indicated by that thick, full thickness dermis. This is a brief snapshot of our story. We've been building from biology to business. We're built on over 2 decades of fundamental research at Yale. Not that our IP is old. My co-founder, Themis Kyriakides, has been studying the mechanism, and we've published over 12 core mechanistic papers. We've worked with an industrial collaborator to secure a phase 1 SBIR to produce genetically modified animals as a commercial source of material, and we've recently incorporated the company, and we've nearly secured a phase 2 SBIR to get operations going. One more slide. This is our launch team. Myself, my co-founder, Themis Kyriakides, is a professor here, as well as some former students and collaborators. Very grateful to the Yale Ventures EIRs for supporting us, as well as our clinical mentors. And we have some upcoming milestones. We're engaging the FDA to confirm our device, as well as predicate classification. We're completing the I-Core program, as well as the Mass Challenge Accelerator program. And we're going to be opening up a $2 million seed round in the coming months to go hand in hand with our non-dilutive funding from the NIH, ultimately driving towards a 510K submission in the next 24 months. Thank you guys for your time.